Well, I have Miss Bailey here with me. You're actually the first guest on my new podcast.
Well,
So
thank
I'm
you for
so
having
excited.
me.
Yes, I'm so excited to have you here. And I just can see the Lord's hand in this whole thing because just the way that you were brought up in conversation, and it just made me think that this will be a really great conversation to have on the podcast that I think that the listeners and the viewers, depending on how you're taking in this information, can really benefit from. So I'm just going to let you start off by telling us a little bit about yourself, like, your background, marriage, kids, family, anything that you feel like, you kind of want to share, just so that the listeners can get to know you a little bit better.
Absolutely. Absolutely. Well, my name is Bailey Lanier. I'm from Cochran, Georgia. My husband and I tag. We've been married since 2012. We have three beautiful children. We have two daughters, ages 3 and 5, and our son is 21 months old. So they are a full-time job. They keep us busy. And a little bit about my career. So I graduated nursing school in 2011 from MCG in Augusta. And actually, from my BSN through NP school, the name actually changed 3 different times. But for clarity's sake, we'll just say MCG.
Yeah.
So graduated, worked on the bone marrow transplant unit for a couple of years, which was an incredible experience. Decided I wanted to go back to NP school. Started in 2013, graduated with my DNP in 2016, and took my boards and started work that summer. So it was wild, but started working at Taylor Regional. I worked in urgent care. So I saw, a lot of sick visits, acute illness. Loved it. Loved every minute of it. And when I came back from maternity leave with Ivy, with my second baby, I just felt a really strong pull to be home more. Finn was 2 at the time, and I knew I wanted another one. So made the decision to come back part-time and transitioned into primary care. So, and I've been there ever since. So, and I was in Hawkinsville, and now I'm in Cochran, which is just completely a God thing, how all of that was orchestrated. And it's a blessing. It is an absolute blessing. So,
Yes. Well, I've heard so many people in the community. We both live in the same community. And so I've just heard so many good things about, people just love to come to see you, and you just give such great care. So I'm super, super thankful that you chose to stay around here and just serve our community. I love our little town. So I know you do as well.
I do.
Yes. So we've known each other for a while. I was actually at lunch on break, filling at the pharmacy some, and that's where her mom works. And so her mom's like the sweetest person ever. So we were having lunch together, and she just mentioned just how you guys like to do things a little bit more holistically at your house, and how your husband like makes all these concoctions and things. And I was like, wow, I need to talk to them, we have a lot in common. So that was kind of how this got brought up. And just the message that you sent back of, gosh, a lot of people could benefit from having conventional care and integrative health care, and just kind of combining those. And so that's sort of the conversation that I'd like to dig into today, because I know that you probably see it from your angle more so maybe in the conventional space part-time, but still, you're in that world. I'm in more of the integrative health world. I see a lot of extremes going on, like, people are just all about conventional care, and they think everything holistic is ridiculous, or vice versa, and I have found that the Lord has really shown me that extremes are not good in a lot of areas. And there was actually a verse, I think it was in Ecclesiastes, that literally said it. And I was like, okay, I get what you're trying to tell me, Lord. And so I just want to kind of just talk about why it would be beneficial to not have extreme mentality when it comes to these things, because I really do think it hurts people in their pursuit of health. And so I say we just kind of dive into that conversation. You know, what was going through, I guess, your mind whenever you typed that message out? Like, what brought you to that place of thinking, wow, people could really benefit from having someone in the conventional space that takes care of them that way, and then also having someone in the integrative health space?
Yes, I know, absolutely. Well, first off, it's your health. It's not one dimensional.
Yeah.
And the healthcare landscape is vast. There's room for more than one at the table.
Yes.
I very much believe in primary care. That everybody should have a primary care provider. That's kind of like it's kind of like the starting point. Okay, so. And I guess I'd kind of like to talk about what a visit looks like and
Yeah.
just share some examples. When somebody comes to me, the very first thing, that we discuss, what diagnoses do you bring to the table? Hypertension, diabetes, obesity, thyroid issues, arthritis, the list is long. So we discuss those things. We discuss the medications that they're on or that they may be concerned about. Then we go through just health history and, different preventative screenings that are, age related, lifestyle related, PAPs, mammograms, colonoscopies, all of those things. And then whatever they want to bring to the table. So, and that involves, physical, emotional, sexual, social, all those things are of equal importance.
Right.
So we bring all that in, we discuss these things. I decide what is within my scope of practice, what I manage, and then if I need to, pursue a specialist.
Right.
And where I see functional medicine, having an IHP, being so beneficial is really allowing the patient to put their health back into their hands. There are so many illnesses, disease processes that we can really turn a 180. Okay. Through lifestyle, diet, nutrition, the basics. And that sounds kind of simplistic sometimes, but so many people, just like you just said, are so extreme. Like, we're only eating 6 hours out of the day. We are not eating for the first 8 hours. We don't eat breakfast.
Don't get me started.
I mean, and listen, and I'm coming from a place of I've gotten it wrong for so long.
Me too.
I was 33 years old before I learned how to prioritize protein. Okay. I mean, we can be honest. In fact, the majority of things that I feel like I teach people are where I got it wrong, where I messed up.
Yeah, me too.
So, but these things are so important. And of course, lab work, which, an IHP would do as well. So there should be a lot of overlap, I don't think, IHP, conventional medicine, there shouldn't be it shouldn't be one extreme to the next. There should be overlap. There should be things that we are both talking to this person about. But I just feel like it really, having that IHP in your corner really helps that person to kind of peel back those layers and get to that root issue. Because sometimes it is really simple. You have that patient who comes in, they don't feel good. They're fatigued. They have no energy, no sex drive. Their lab work is normal. They don't have, they don't really have a diagnosis that supports them feeling that way. And then, you learn that part of their lifestyle is really, really extreme. They're only getting 4 hours of sleep at night. Things of that nature. And your body's going to tell on you eventually, it's definitely, it's going to tell on you. So,
I'm so glad that you kind of painted a picture of what a primary care visit should look like. However, I'm not sure, and maybe you can speak into this. I feel like either people aren't getting that in a visit, or in their mind, they're thinking about a specialist that spends very, I just think that people have in their mind, maybe from experiences, maybe from others sharing experiences, that doctors just don't spend enough time and look at a big enough picture to really help them move forward in their health. It's really just all about prescribing medications. That's
Yeah.
just sort of, that I hear that a lot, and people are very
Right.
frustrated by that.
Right.
So, any thoughts on?
No, lots of thoughts. Could write a book.
Yeah.
I think that I feel like I was in such a neat position when I came in urgent care, in that I was so well supported. So, when you first start and you're green, you need a lot of help. So
Yeah.
I was right there within the confine of the hospital, and I was surrounded by the clinics and all of those providers, even including pediatrics. And the ER was right beside me, and the ER physicians have just always done such a great job about being available.
Yeah.
So I, I was really able to utilize all of that. I got to learn a lot from all of those people, and I think that the providers, I really do feel like the providers at Taylor do a good job of trying to look at the big picture.
Yeah.
But so much of it is you've just got to find that person that you trust and that you can build that relationship with, somebody that is invested in your health.
Yeah.
And I feel like we do a good job of that, but sometimes just different personalities, it's a very personal thing, and it's okay. I'm probably not everybody's cup of tea, and that's okay. You need to go find who is,
Yeah.
um, and somebody who is open to different things, because um, there's a time and a place for an appeal. There's a time and a place for an antibiotic.
Yeah.
There's a time and a place for surgery. But there are a lot of things that can be fixed naturally, um,
Mm-hmm.
and we should be open to that. We should be having those conversations,
Yes.
and we should be supporting it. So,
Definitely. You know, as people are listening and watching this, they're probably like, well, I'm just going to move to Cochrane, and you're going to be a physician, right? Sometimes it does feel you kind of, you are living in this extreme. Maybe you've had a bad experience and you're like, there's just not a good provider out there. I would just encourage you, and Bailey is encouraging you, to keep going and keep looking, and ask around, try different people. You really do need to try to find someone that you can trust, that you really feel like is going to look at the bigger picture and advocate for you and help you in that, as you advocate for yourself, I guess I should say.
absolutely, absolutely.
Yeah.
Well, and I feel like, there comes a point that something else I see so much, and it's awful. People will find a medication, like my diabetics, we'll find a medication, we'll find an injectable that is so effective. And we might get that thing covered for a year, and then we don't. And then it's $1,000 a month. And, we've, but we're just relying on that. We're not doing anything else to try and and fix the root issue here.
Right.
And type 2 diabetes is something that can be turned around.
Right.
I could use this example. She won't mind. My mom,
Mhm.
she had, and she's an active,
Yeah.
healthy individual. This was probably about a year and a half
I
ago.
think it was, that's
I
about
think
right.
she had a lab work done. Her A1C came back. I
Was it
think
like,
it was like 6 point.
I
It
want
was
to
either
say six?
6.7 or 6.9. I mean, it was
Yeah.
into diabetic range.
Yeah.
And she just made the decision. She took a step back. She looked at her lifestyle, what she was eating, um, you know, exercise, all the things.
Hmm.
Um, and she made changes. And 4 months later had her A1C drawn again, and it was 5.4. So,
Wow.
and she's been below the, the pre-diabetic range ever since. So,
Yeah,
these things, they can be done. They can be done.
definitely.
So,
Yeah.
and I think it's so important to really achieve optimal health. People need to be engaged in their healthcare. They don't need to just be reliant on just me or just you. And I
Right.
feel like our job is to encourage, support, and teach people how
Yes.
to do these things, how to be their own advocate, how to make these changes, because it can happen.
Yeah, definitely. And, you know, a lot of it is dependent on what we choose to do as the patient, right? For our own health, because I just see a lot of people that they do just want the quick fix. And that is a mentality I think that you have to get out of, and really saying, what can I do? What things do I need to change? Because just like your mom got that result, she could have very easily just went on medication and not changed her diet, her lifestyle basically. So it
Exactly.
is up to us. And sometimes I think this is the enemy, but sometimes, I'll just maybe have a discouraging day and I'm like, gosh, all people want to do is just have a quick fix. Like they don't want to invest in their health anymore, but that's just simply not true. I think some people, they just maybe have a mindset shift that needs to take place, or B, maybe they've tried things and they just didn't get the outcome that they wanted. And so they just think those things don't work. So I
No, but
think whatever,
that
go
is
ahead.
I'm so glad that you hit on that. And that is also where I feel like functional medicine, having an IHP, can really be that catalyst. If I had to give myself criticism, and you have to do this because I
Yeah.
feel like it makes you a better person, a better provider, is I do get, I get kind of antsy, or, um, I want them to understand so badly. But you have to meet people where they're at.
You do.
And they may not be ready to make that transition. You may just have 2 conversations, and you might have to have 9 conversations, and that's okay.
Right.
And the same has been in my life.
Mhm.
I feel like, uh, when I had my children, that was really, if I had to just discuss my own health journey, I feel like that is when I really started to prioritize things, because I wanted them to have the best.
Right.
And then, you go through the periods of just having babies, nursing babies, and you're just kind of in survival mode.
Right.
And then, you have that last baby turns 1, and you just kind of realize, oh, okay, I have some work to do. And, and that's how it was for me. I didn't feel good. I didn't have a lot of energy. 2:30, 3 o'clock every day, I just could have laid out on the floor, to take a
Mhm.
nap. And, I just realized, like, I don't want to feel like this. I want to be able to play with my kids. I want to have energy.
Right.
Um, so that's kind of what jump started it for me. It
Mhm.
took 3 babies and
Yeah.
and 32 years. So, you have to meet people where they're
Mhm.
at, and you have to be patient, and, um, you just have to continue to have those conversations, and introduce those things. And like I said,
Mhm.
that's where I feel like having an IHP can be such a catalyst. It's another set of eyes, another set of ears, um,
Definitely.
another, another form of healthcare, that, supports natural remedies, and,
Mhm.
just really, really digging and finding the root of the issue. So,
Yeah. So, in your opinion and from your viewpoint, do you think the conventional system is set up to really address the root cause of things that pop up in your health?
yes, but then but there's a very big but here. uh, the downside, so much about that is probably more, it's the provider. Okay.
Right.
I mean, you can line up 10 physicians, 10 nurse practitioners, 10 physician assistants, and they are all going to do things very differently. So that is why I always stress, find your person, find that person that you just know, like, okay, this one's for me. We're going to have a good relationship. They're listening, they're supporting me. They have my best interests at hand. So I think that's big. I think where we fail is time. And we just have to be, you have to be honest about what's going on. We live in rural Georgia. Healthcare is a little sparse. We really don't have enough providers, in my opinion. And everybody is really, really busy. That was one thing I saw all the time in urgent care. Like, hey, it was going to be 3 weeks before I could get in with my primary provider. Like, please see me, please help me. All the time. So there's a lot of need. People are busy. And it's a business. And time is limited. I could spend an hour talking about health and wellness, but there's a lot of other things we have to cover: screenings, lab work, whatever they want to bring to the table. There's a lot that we have to do. But that doesn't mean that discussing those root cause, it doesn't mean that's any less important. But sometimes that, that's cut short, and people don't want to come. I would welcome if somebody's like, hey, listen, I'd like to come see you once a month, and let's just dig this up and figure this thing out. I would welcome that, but nobody wants to come to the doctor's office that frequently. And I get it. We're busy. There are a lot of people who are just in survival mode right now, kids, activities, all the things. So that's what is so neat about your practice. And you can speak to this more than I can, but I'm sure you would have somebody, come in, but there's so much that you can do virtually or over the phone and kind of have this continual conversation. Something comes up, hey, I wonder what she thinks about this. You can shoot it in an email, a message, and just kind of keep that going. And then, the fact that it's just, the blessing that you bring the Lord into everything that you do. It's just icing on the cake. So people need to take advantage.
Well, thank you. I just think that maybe in our minds, again, this kind of goes back to the extreme way of thinking, is that, doctors just don't care. They just don't have time, all of these things. And while I won't say they don't care, it is a matter of time, and it is a business. So we have to remember that. Also, just within this whole grand scheme of things, there's just so much that lack of ownership, I guess I should say, that people often have when they come to healthcare, right? They just want to go to the doctor and they just want them to tell them what to do. And hopefully it's very easy. It includes something that is more of a quick fix. So that's not anything to do necessarily with the conventional system. That is a mindset that we have as the person that's coming in, wanting to take advantage of that. So I think that the conventional system gets a really bad rap sometimes. I worked in it for a number of years. It has flaws, but it also has some really good things also. And I do think it goes back to finding your person. I love the way that you put that, just like find your person. That would go for a lot of things in life, but why do we give the whole conventional system a bad rap when we don't find the right person and we're not happy with that person? Like, you can move, you can, can keep searching until you find the right person.
Absolutely. And that is welcomed and supported, everybody has their niche, Brandy Wynn, she's a nephrologist. You have kidney issues, she is your doctor. She's wonderful, Kyle, the guy that I worked with, he worked in ortho for several years. So, everybody has different things that they can bring to the table. But, it's, you gotta, when you have that visit, you have that, you start that conversation um, and if if it isn't what you thought it should be, if it didn't, if you didn't feel supported, then find somebody else. That's okay.
Right. And I think our expectations also need to be checked as well. Like, are we just looking for somebody to give us a quick fix, or are we willing to put in the work? Do we have unrealistic expectations when we want the doctor to like fix everything? So I think that the expectation there is just not realistic in a lot of cases. So, I think there are flaws or maybe not flaws, but they're just, it really does benefit you to have people in different areas of health to help you get to where you want to go in your health. So for instance, I work only virtually. I can't lay hands on you. I can't take your blood pressure. I can't feel, I can't do any kind of exam, nothing like that. Right. So I'm more accessible. I can look at things from a different view. I can do all those things. However, you do need to have a primary care doctor that you go to that does look at things differently than I would, that has different training. I think that that's something that maybe is overlooked because people are just so done with either one, right? They just kind of, they leave out a big picture of the puzzle that could really help them get better. Because really, here's the thing also, I think that's really key to keep in mind. People are just okay with not feeling well because they think that's normal, right? You get a group of friends. Go ahead.
They don't know what good feels like.
No,
really.
Exactly. Right. I mean, they get together, you get together with some of your moms. God, we all feel tired. Well, I guess it's just normal to feel tired if you're a mom, right? I mean, I have terrible cycles. I guess it's just normal. We just kind of normalize these things, but I believe that God wants us to have the energy to do what he's called us to do. And I mean, that kind of goes for all aspects of health. I just feel like we just really not stopping at mediocre when it comes to that and just dealing with things just because we think that they are very common, but they're not normal. That to me is, I think moms are really struggling because they just have accepted these things and they just think that they're normal, but they're not.
Right. Or, it was blamed on their hormones or just the season of life, age. And, there are hormonal changes, there are age-related changes, but, it's just not normal to walk around and just feel like you have no energy. It's there, like you said, there are a lot of things that I feel like some providers have kind of just normalized or just been like, oh, it's this and that's it, close the door.
Right.
I have one particular patient. She was having issues with runny nose, stuffy nose, postnasal drainage. She was getting weird rash, different areas of her body, some periorbital swelling.
Mm-hmm.
And, she saw her primary doctor, ended up seeing an allergist, food sensitivity testing, the whole 9 yards. Anyway, she just wasn't getting anywhere. And rash, the edema started getting worse. And in particular, antihistamines just were not, things like Zyrtec and Claritin that shouldn't make you sleepy were making her very sleepy. So Benadryl and hydroxyzine just zonked her.
Yes.
And she just felt like a zombie. So she was really, really desperate to try and find something else. So she sought out a virtual functional medicine ND. Yeah. And come to find, they were peeling back the layers, really discussing what was in her house, at her job, because she was noticing at work the symptoms were way worse. And come to find out it was synthetic fragrance.
Oh, interesting.
Mold. It was synthetic fragrance. So like the Febreze air fresheners, the wall plug-ins. There were some different Bath and Body Works stuff that she had within her home that once she eliminated all of those things, her symptoms completely disappeared.
Wow. I love that.
And it was simple,
Yeah.
it was simple.
Yeah.
It was just a matter of, all right, what's really happening in your life? Not chasing a zebra. Like what is around you? What are you surrounding yourself? Just really diving in and having that conversation.
Mm-hmm.
So,
wow.
She's just a good example of that. So,
Mm-hmm. I think that I've just really enjoyed this conversation. I feel like we could talk for a long time more. Maybe we'll have you back on, but I just hope that this episode has maybe just helped you to think a little bit differently about how these two worlds can work together and how they really should work together, that it doesn't, and it really shouldn't be one or the other. And to your role that you play in your own health journey and how important that is, and just finding the right person. That goes for conventional and that goes for more of a functional or integrative, right? Everybody kind of does things differently. And that could be seen as a bad thing, but I really think it's a good thing because, and pray about it. I think that's really important. Like God's going to lead you to the person that you are supposed to be with. Even if that takes you a couple of times to try and maybe it doesn't go very well, don't give up. And if you haven't seen a primary care doctor in a while, maybe it's time to go and get a checkup with them. Even if you are doing things that are proactive in your health, just to have that person that you can go to if you need that care, but just for them to look at you in a different light than maybe somebody like myself would. So thank you for having this conversation. I really enjoyed it, and I hope our listeners did as well.
Thank you for having me. I appreciate you.
Yes.